All right, so I think we'll go ahead and get started, although we may continue to have some people trickling in. We're so glad to see everybody here today. This was sort of a, not last minute, but quickly added in conversation. I think because the issue around monkeypox is evolving, and it's evolving much more rapidly in some communities than others. So we wanted to create an opportunity really for everybody to come together, have this conversation today. This is a coffee chat, so I'll give just a brief reminder to everyone. We haven't had a coffee chat in quite some time. This is not a formal presentation or conversation by any means. We don't even have any slides prepared, which is shocking if anyone has ever been to anything I've facilitated. But really, the goal of today is to give you all an opportunity as program directors, program staff, people working with people experiencing homelessness, an opportunity to just come together and share with each other about kind of what you're seeing in your community around monkeypox, things that you're doing to prepare your program, or if you're like, oh my gosh, we just are barely breathing after COVID, we haven't even begun to think about this, really an opportunity to learn from each other in the community. So that being said, the majority of this is just going to be discussion amongst you all. So I certainly invite everyone, if you're comfortable in a place that you can do so, turning off your cameras, feel free to participate in a way that is comfortable for you. So we're going to monitor the chat. You can also just sort of jump in and add into conversation. You can also raise your hand using the raise hand feature if that's easier for you to jump in. But really, again, very, very informal. We have some questions that we'll start with, but really at any time, please jump in to ask questions of each other and learning more from each other as well. So as we just sort of before we get started, I think monkeypox is relatively new for all of us kind of learning. And so I'm actually going to have Kate from our clinical team just do a really brief sort of introduction around what we know about monkeypox right now. We'll talk quickly about what we're seeing with respite programs, and then the rest of this time is really going to be conversation among all of us. So I'll turn it over to Kate, and then we'll go from there.
Thanks, Caitlin. Hi, everybody. So I'm Kate. I am the Clinical and Quality Improvement Nurse Manager here at the Council, and I'm located in Philadelphia, Pennsylvania. So I think I'm going to give a very brief overview, just so we're all kind of on the same page about monkeypox or MPX. And then, as Caitlin said, we really want you all to be able to kind of direct where the conversation is going to go and where your needs are. So I'm just going to kind of do a quick overview and bring up a couple things, and then we have a few questions, but we'll let you all take over. So monkeypox or MPX, this is a virus. It can be transmitted by contact with sores, with scabs, with like fluids. It can be transmitted through soiled clothing that has been in contact with someone who has sores related to MPX, and it can also be transmitted through respiratory droplets. People are symptomatic from when symptoms begin until the sores have completely crusted over, the scabs have come off, and there is new skin underneath that's completely healed. People usually get symptoms with 5 to 21 days after exposure. Symptoms usually start with a fever. People often have swelling in their lymph nodes. They may have muscle aches, they may have a headache, and then typically 1 to 5 days after that is when people will begin to get the rash. Then it's kind of a pimply looking rash. People could have multiple or just one. And in the case of what's kind of spreading now, it often starts on the face or in the genitals. So those are the two places that it can begin. Sometimes it might stay there. Sometimes it can spread to other places on the body. As I said, people do remain contagious until the scabs from the rash have have fallen off and healed over. Vaccination is available. There are treatments available. Right now, those are both kind of limited in terms of who's eligible for them to folks who have had an exposure who are high risk, either for transmission or for complications, and that we can kind of go into some more specifics of that. I'm going to put some resources in the chat. I think in terms of medical respite, and again, we want you all to kind of talk about what's happening for you and the areas of concern that you have, but there are a few areas that come up, at least for me, in thinking about respite and MPX, and one is just isolation. So The isolation period needs to last until the scabs from the rash have healed over. That can be up to 4 weeks. So that's a long time for folks to be in isolation. It's a long time for a respite to maintain someone in isolation. And it's also a long time for a client to be in isolation. That can be quite difficult in terms of mental health, in terms of, access to all the things they're typically used to being able to do. Another area for respites might be pain management. The sores can really be painful. And so that can be a challenge, I think, in terms of management. If someone is in a respite, they would likely need some support with pain management. And then very importantly, staff safety, PPE, just thinking about things like laundry and how to make sure people are protected and how to kind of set up that isolation. So I'm gonna end there and just kind of set us up that way and hand it back to Caitlin to prompt us with some additional questions.
Perfect. Thank you, Kate. Yeah, so just a brief overview. And as Kate mentioned, there are a couple of resources, some from the council and some from other places that Kate will share in the chat just to kind of go more in depth around that. But I think one of the challenges that we've been hearing from the field is that, programs really figured out what they could do around COVID and isolation and quarantine. And unfortunately, the transmission of monkeypox is a little bit different. And so that changes some of these protocols and safety for staff and what needs to happen with that. And also the resources are very different this time around when we're looking at this challenge as opposed to what communities were doing around COVID. So that all being said, I'm going to throw out the first question here. And just really, I'm curious to hear from you all if anybody has yet been asked to take anyone in their respite program who has monkeypox to complete isolation, quarantine, or treatment. And if you have, how have you responded? Or if you are seeing it in your community and this is something that you have thought about already. So, open it up with that first question and please feel free to jump in with your experiences. Or even if it is ramping up in your community a little bit, and just kind of what maybe your health center or others are doing. So some folks, it's not active yet. Oh, so Karen, you have been able to offer vaccines to guests. That's great. If you want to talk a little bit more about who and how you're working with to be able to do that, if you wouldn't mind. Karen, I'm not sure if you're sharing, but you are still on mute.
I was typing.
Oh, okay.
We have an Oakland County nurse that we work with. She comes in every other week to test us for COVID. And so she brought us a fact sheet and we read it to the guests and have it posted. And then when they do COVID testing, they can ask to speak to the nurse in a confidential area, and they can request the monkeypox. And then once the new COVID vaccine is available, she will be taking all guests into a private area and asking them if they want the booster, the new booster, and or the monkeypox.
Great, thank you. Yeah, so just, I guess for disclosure for folks, Karen, your program is shelter-based, right? So you're not based within or staffed by a health center, is that correct?
Correct.
Well, that's wonderful. I'm glad you guys have something set up to have the vaccine available, because I know that that's been a challenge for some communities and even getting that access to be able to offer it to folks. Yeah. Mary, I see your hand. Please jump in.
Sorry, I had a bit of trouble getting off mute. Mary Tornabene from Heartland Alliance Health in Chicago. We were offered by HRSA to join MPX vaccination program, which we were very happy to support. So we've been rolling out for the past 10 days MPX vaccines to our high-risk participants, mostly our HIV Ryan White participants, but also other members of our community who are PrEP and other high-risk participants as well. We have not seen any cases in our MPX in our shelter community, but have had multiple cases within encampments in Chicago. Our team, led by, with our behavioral health, Lyndon and Michael, who are on the call, we're in the process of working with the health department to open a 10-bed respite for MPX and COVID. So we're really looking forward to learning from all of you who may have been working in this space at this time. But we've had some beds for tuberculosis isolation, and the health department actually asked us to use those for MPX, and had some problems with the building, but great team was able to work them out, and everybody did well. The people that we had in there, I haven't received as many calls lately, but for some time, my only answer was no, I have nothing. So I'm not certain what's going on out there right now, because I think we just didn't have capacity. We only had 2 beds. So I am so sorry.
Yeah. Yeah, that's challenging, but exciting to hear. Oh, Courtney, I think you were going to jump in.
Yeah, Mary, this is Courtney. I was going to ask a follow-up question. For those folks that you were, even the few amount of beds you had, that you were able to get into isolation for MPX, I was curious if the duration of the isolation was a particular challenge, if the clients stayed in isolation for the full duration, and kind of how you supported them holistically to isolate for such a long time.
It was a challenge. Lyndon, please jump in. It was a challenge to get people to stay. We would initially couldn't get people into the place where we actually wanted and had to rent a room. And then we would go by the hotel and people would be outside and there'd be other people in the room. And so it was a big challenge, and there was a lot of support with our behavioral health team, and case management is absolutely fabulous to support them. One person at the first, so we've had them in 3 different places. The first hotel space we had, which is our COVID isolation space on the far south side, there were challenges there too as well, but the initial 2 or 3 that were there stayed. I think everybody did stay until they were done. It was just some behavioral health issues that we needed to work through with people.
Thanks, Mary. That's really helpful. I think that's been one of our biggest question marks, is really how to support people well. What are some of the challenges that will emerge just during that long length of time? And obviously we've had lessons learned around COVID isolation, but 3 to 4 weeks is really profound.
One of the things, the rooms we had didn't have any, we rented from an SRO. So there was no internet, there was no television. And we tried to go and get these things, but we had to move people in while we were doing that at the same time. So that was a bit of a challenge, but I think moving forward, we'll be able to have all the pieces in place.
Yeah, I think that's a really helpful thing to think about. And thank you, Courtney, for the follow-up, just because there is that challenge in, I think, that wraparound, both in having the point person, the case management, the behavioral health, in addition to the medical support, and thinking about what are the activities, what are the things that we can bring to people throughout the day to help them stay in those spaces, just to support them, help them feel better. Because as Kate mentioned, there can be some pain and discomfort associated with that. And so staying by yourself while in pain is really challenging if you don't have any distractions among just sort of the other needs that we have as humans to be engaged in other things. So it's a really important thing to think about, I think, as programs are getting ready. Again, I know we've learned some lessons from COVID isolation and quarantine, but this can be longer. And so thinking of how to expand that and continue that for folks who need it. So are there any other programs who have had anybody with monkeypox, either referred to them specifically for monkeypox, or someone who's been in your program who has then been identified as having monkeypox, and any responses that you've had or changes in policies and procedures, anything that you've done to help address that?
So this is Amy Gordon, in Minneapolis, healthcare for the homeless, medical respite, and sorry, can you hear me?
Yes, we can hear you. Thank you, Amy.
Okay, it's just there's other voices happening. So we have just transferred, and I don't know if there's anybody else on here from our space, but we just moved in our medical respite 30 beds into a partner Catholic Charities space that does permanent supportive housing. And we just opened in July. We prior were shelter-based, and I still feel like we can think about it as being shelter-based because the shelter-specific community partner is Catholic Charities that runs the building and services the space, and then we provide the medical support and the respite cares, so to speak. And initially kind of building up our respite intakes, we started with having our main community partner, Community Hospital, have hospital discharges coming into our medical respite. And now we have built up into more community referral-based bed offerings. And we've had multiple referrals who are monkeypox positive for us to be able to intake. And frankly, our team, which is very small, there are 4 of us, which is really like 3.25 people, because I only work so many hours a week in respite. We have pushed back on this simply because there hasn't been a huge amount of support for various services while the person is there being expected to isolate. And it is, it's a permanent supportive housing building that has 5 floors. There's no separate elevator access. There's shared bathrooms, there's shared showers, and there's no television, there's no phone access in the rooms. And so we've really, as a medical respite team, we've really pushed back, but our collaborative partners and our management is wanting us to be able to open it up for these for individual referrals with monkeypox. And it's been really challenging. I guess, I don't have any words of wisdom other than how it's been challenging. And do we want to be able to provide this service? Absolutely. And we have, come up with kind of thoughtful guidance around if it's an incidental finding of COVID, we can figure out, I think, how to manage this in a way that is safe for the people in the building, in addition to the person itself, just because of potentially shorter duration. But there aren't a ton of supports yet, I feel like, for monkeypox. We do have ways to vaccinate our folks, working within the public health department, because we are part of the public health department in Hennepin County. We haven't done that for our medical respite clients currently, and that's really great for me to start thinking about, to be able to offer that for our folks. So I appreciate hearing that information, but that's kind of all I have to offer.
That's okay. Solutions are not required as part of this conversation, because I think it is helpful for us really to hear what the challenges are, both for us to think about, from the council perspective, what we can do to support programs, but also then brainstorming, I think even collectively together today, on some ways that folks maybe are thinking about if this referral comes in, how am I going to address that in my program? And what things do I need to have in place, or what resources are going to help me be able to do that, right? Because I think, thinking in your case, Amy, is it saying, okay, if we take these folks, then we need, A, B, and C to equip these 2 or 3 rooms. Do we need iPads in the room? Do we need TVs? Kind of trying to preempt those things before it becomes a challenge with keeping folks safe.
And that's essentially what we've asked for. We've asked for communication devices, whether it be phones, track phones, iPads, in say 1 or 2 rooms that we can then, identify as being those specific rooms, in addition to asking for televisions and other potential entertainment devices for those rooms too. And that hasn't been accommodated yet. So those are some of the things that we have asked for, to help with this guidance. So not saying that we're going to open up all 30 beds for this potential isolation, but hey, we could do this for 1 or 2 of the rooms, but it hasn't been accommodated yet. And it again, it's challenging.
Kate, there is a question in the chat around whether or not you can have two people with monkeypox isolate together. So I think it might be helpful to think about how that might work.
Yeah, people can. So I think, I don't know of any programs in particular that have done this, but if there's a physical way to kind of have a separate bathroom and rooms for those folks, they could do kind of like a wings model, to have like one wing for respite folks who do not need isolation, and then one for folks with MPX who, could use a shared bathroom and have a shared space. So that is possible. Kind of depending on your physical setup.
That's helpful to think about because again, a lot for shelter-based programs, I think that has been one of the concerns around taking folks in is that if there aren't individual rooms, or even very few programs have individual rooms and individual bathrooms. So how do we do that safely? How could we be able to take folks? So it's helpful guidance. Any other challenges that programs have that you all have been thinking about and thinking, man, if the hospital refers someone to me with monkeypox or someone from my health center, anything else that's sort of weighing on your mind that like, we need to figure this out and we don't know how to do that yet. Any of those concerns, we can talk about those now. Yeah, Mary, go ahead.
Has anybody had any experience with laundry? I mean, we have policies based on, the CDC guidance, but would really love to have some guidance on someone with experience.
Well, see if anybody has any thoughts. Mary, I don't know, because I'm wondering if Chicago is more ahead of this than other communities that are on the call today. But yeah, any folks have any thoughts about managing laundry? Because that's one of the more unique challenges, I think, of this versus COVID, is handling belongings and items. And staff, feel free to jump in if you've been in other calls with folks who have brought this up as well.
I think I can just jump in and say, certainly whoever is handling laundry would need PPE, like eye protection, gloves, gown, and an N95 mask. But I also have wondered, and I don't know if anyone else has had experience with this, but shelter staff are used to doing laundry when someone has like body lice, for example, or scabies. And I have wondered if it might be helpful for folks to kind of think about it in that way and do some of the same things that you would do in that case to kind of make it seem a little less intense. It's just another situation like others we have encountered in congregate settings where you need to kind of do that person's laundry separately and do it in hot water and a hot dryer and protect yourself. So that was just I don't know if folks have thought about it in that way, but I have wondered if that would help staff to kind of feel a little better with handling the laundry situation.
Thank you, Kate. Yeah, and Stephen just posted in the chat as well that the Alameda County Healthcare for the Homeless program has developed some recommendations that are in the chat here, and I'll just read it just in case folks are in a place where they can't see the chat, but pay particular attention to handling laundry. Soiled laundry should be gently and promptly placed in a laundry bag and not shaken. Linens can be washed together using regular detergent and warm water. Laundry staff should use masks and gloves until wash cycle is completed. So very similar to what Kate was mentioning. If there are other sort of things that are more familiar to staff, such as body lice or bed bugs, like following some of those similar protocols to protect the staff, their skin, exposure to their own garments. That's a great question, Amy. So does anyone know around if a hot box might be useful for the belongings on entry to the program? See if there any of the experts in the room or anyone else has thoughts on that. Yeah, Courtney emphasizes that that's a great question. Yeah, I'm curious if, in terms of the laundering of items, because Alameda County is warm water, similar to other types of infectious agents, if there's specifically recommendations around temperature of the water, right? Is it just washing belongings? Do they need to be in hot water? Again, I know from addressing bed bugs, it's like the hot water, but also the heat of the dryer is really what solves that problem. So that might be something, Amy, we might not have an answer for you to today, but we're collecting these questions and concerns. And that might be something that we can kind of pull together some guidance or thoughts on. So I think we can kind of open up a really general question. If folks, what is your concern around monkeypox or MPX in your broader community for people experiencing homelessness, and then trickling to that, how that might affect your respite program? So what are our concerns around this, just sort of in general? Maybe it hasn't made it to your community yet, but what are you thinking about, or what are you foreseeing happening?
For us here in Atlanta and Mercy Care, I think kind of my concern is, here, thank goodness we have in our city, we have what's called lovingly the COVID hotel. So we have, that for persons with COVID. But I'm concerned in regards to persons that may test positive for monkeypox. Like, where are those people going to go? Like, once they're on your actual, respite or recuperative unit, and yeah, and I know for us, we have everything is community bathroom. Only thing that's not is your individual room. And so if someone tests positive for COVID on our unit, we can refer them to the COVID hotel, and all is well. If someone tests positive for monkeypox, like, they can't stay on our unit, but where do they go? Where do we send them? And I haven't heard anything in our city about, trying to answer the call of monkeypox amongst the homeless.
Yeah, thank you, Kenya, for bringing that, because I think that I won't speak for folks, but I think that is a concern, is that, again, the community response for COVID was like, okay, we've got to figure this out. We have these buildings, these hotels that are not being used. We're going to bring people in there. And that is not what is happening this time around, I think, for a lot of different reasons. So there's not sort of this citywide or community-wide support network that, when this does happen, I think it's being tasked with programs to figure it out, as opposed to having a resource available. Is anyone else feeling a similar concern or seeing something similar within their own community? Yeah, so Amy's adding in that their COVID hotel has been closed. And I think that is also something that's happening, is in some places, there's not even those places available for COVID anymore. And shelters are now being tasked with isolating positive clients for COVID, and that there doesn't seem to be a plan for monkeypox. So I think, again, that is, I think, a big concern, is, because the precautions around this are different. It's in some cases going to be more challenging, but the shelters are going to have to adapt to it. Curious if there's any folks that have thought about policies and procedures about how you might do that in a congregate space, or have looked at some of the guidance that's already been put out, and have any concerns about the guidance, or anything about the guidance that they feel like they could work around. And I'll just note, Kate did put in the chat the CDC guidance for congregate settings, as well as the council fact sheet on monkeypox.
So Caitlin, I'll just jump in for a minute. So part of what we've been doing at the council is working with our colleagues at HUD and trying, and certainly our partners at CDC as well, and thinking about how to support shelters prepare and respond to MPX. And so as Brian put the link in the chat, a lot of products are just coming out now in terms of providing guidance to shelters. And certainly that's COC or HUD funded shelters, which are along COCs. And then the other thing is I went on to HUD office hours to talk about MPX just 2 weeks ago. And so I think this is just something now that shelters are thinking about and responding to. I don't think many have anything established. I've had some individual TA requests for folks who are experiencing homelessness who have MPX, and I've been trying to connect them to local resources. And right now, it doesn't feel like there's very, how do I put it? It's not very organized responses. It's not, with COVID, it was very much, you test positive for COVID, and then as a healthcare for the homeless, I could put in a referral and someone, kind of all these services get activated and someone gets to go to a hotel and motel. And right now, what many jurisdictions are facing is that there's really not a standardized set of response. Not every program has vaccines. Not every program has access to testing and treatment. So we are seeing some counties that you have to be referred by a hospital to get into isolation. That's what I found out in San Diego. So if someone's experiencing homelessness, they have to go to a hospital, be diagnosed with MPX to be able to get into an isolation. And we all know going to the ER is awful and so full of barriers, so many barriers. So I just wanted to just highlight how kind of disjointed this probably feels for all of us, because it's not feeling like there is a kind of standard process. I think part of the challenge is, it feels like everyone is just having to piecemeal the response right now. So I just want to kind of highlight that and empathize with everyone who's, trying to put these pieces together. And just hearing Mary kind of share, it feels like we're trying to turn every stone to find the resource, to find a place to support isolation, trying to pull funding together, trying to support shelters find isolation within their spaces. So I think everyone's trying to do the best they can, and we don't have a full mobilization of more additional funding and additional resources to do this. I just want to acknowledge, this is, you all are doing really great work, and this is really hard right now.
Thank you, Courtney. Yeah, absolutely. And so I'm curious into that because as Courtney said, things are just starting to come out. I'm curious to hear from you all as we see how this develops throughout the country and in different communities, what resources would be helpful from the council, from NIMARC, around MPX that might be helpful for you all. Or there's, feel free to throw ideas in the chat, but we really would like to know what do you all need as you're kind of approaching this in your communities? I know that just from our side of things, often people are asking for policies and procedures. So if you are a program that is working on them or have developed some, even if they're not final and refined, right, because you're figuring it out as it goes along, if you have those to share, we would be more than happy to take those and share them with programs. And if you prefer, we can certainly de-identify them, or you can de-identify them. I think because as programs are figuring this out, I think they'll be curious to know how others have approached it. And that way, that will help us be able to support other folks as this is coming around, and we can kind of share back and forth. I'm going to put my email in the chat there, just making sure I got my C's and H's right. So if you have any policies and procedures from your program, please feel free to send those to us that you would be willing to share out. As folks approach us, we might have some resources there. But if there are other things, you know, as we're kind of figuring out what we need to do to support you all beyond that, is there anything else that might be really helpful for you all? And just getting your programs ready, or even, you know, as Kenya mentioned, if there's not going to be a citywide response and it comes to your program, what do we do? Let us know what might be helpful. I think we'll just do a couple more questions here. But one of the things I think around one of the barriers perhaps to developing community-wide response is potential stigma around MPX, and who it's affecting and why it's affecting certain populations. So I would love to hear if that is something in your community around, you know, if you've heard or how it's been talked about, both in your community, just sort of along colleagues, or even just in the news. What are some things that you might be seeing around stigma, if that has come up at all in MPX?
Just say that I've received a number of individual TA requests from folks experiencing homelessness, and in terms of stigma, they haven't mentioned it in particular, but they shared, you know, really common things that have created barriers for them. So one gentleman had a dog, and so he didn't have a place that he could isolate with his animal, and so that was creating a huge barrier. And that made it difficult. He couldn't go into the emergency department to be able to access isolation because of his dog. Another woman in Connecticut said she couldn't find any available resources for someone experiencing homelessness to isolate. And so, you know, I know there's a lot of stigma around MPX, especially with the association with the MSM community, and disproportionately impacting BIPOC communities. But I'm also, even in addition to those, I just think homelessness right now, also because of lack of access to isolation, feels stigmatizing in terms of creating a public health response, and that many people don't have access to isolation. And not only I think about it in terms of isolation for to help protect the community in public health response, but also those folks feel miserable. They have basically flu and painful rash for weeks, and I imagine having to leave the shelter or sleep outside while you're feeling that crummy for weeks on end. That's just awful. And so I think of stigma more broadly, and just added layer of complexity of just simply experiencing homelessness. Once again, is really causing significantly more suffering related to this infection.
Yeah, absolutely, Courtney. And I'm wondering too, as potentially as it grows through different communities as well, I know some are more affected than others, even the kind of perception around need for the vaccine, how that might be affected, depending on, again, people's perceptions of who is at risk and why they're at risk. It'll be interesting to see how that might impact vaccine uptake as well, for folks who are, when it is available and offered to them too. I don't know if anyone has experienced that as of yet. I know there's only a couple of people who have been able to offer it on the call. If you've seen any kind of how people have responded to being offered the vaccine.
I know our local Vanderbilt Trans Health Clinic, Gender Clinic, is doing a lot of community education around how to talk about monkeypox and towing that line between wanting to make sure that we're distributing resources to those who are at the highest risk and the most vulnerable, but also not tipping the scales too much to the narrative of people prejudging people based on their identity, whether they'll have monkeypox, and just kind of echoes that I think we usually face with public narratives around people experiencing homelessness, that they're more likely to be victims of violence, for example, than perpetuate violence, but they're often seen as threats, and trying to really reverse the narrative into a population that deserves care. Anecdotally, folks that I've talked to in the community and in the homelessness services community also feel like there's some echo of that can be triggering of the HIV/AIDS epidemic in terms of the lack of resources and awareness that can be going towards these issues, and that being connected to the population it may be affecting, and really needing like a public health response, and that being a place where health centers can really step in terms of having a public health education for the community on who does this affect and why. And some of that has been needed in Nashville too with vaccines. I think they've opened it up to folks who have close contact with someone with a case and anyone part of the LGBTQ community. So there was some confusion around that's such a huge group of people. And there's just a little bit of confusion around like, why is it opened up so much to that group in particular, and wanting to manage narratives around that to make sure that stigma doesn't increase. Again, that's just kind of anecdotal from Nashville. I'm super curious what that looks like in other communities.
Yeah, I don't know, Amy, if you're still on, or Mary, in terms of offering vaccines, if you've had any experience with that. I think Amy maybe had to go around.
So,
oh yeah, go ahead.
Yeah, we initially made calls to all of our higher risk Ryan White participants, and then we eventually this week we're finishing up for all of our Ryan White participants and everybody who is on PrEP, and then we have taken to doing focused events at a couple of our shelter-based and outreach-based sites that we provide services. We at a couple of train safe sites that we're prioritizing for vaccine, and have a plan to prioritize vaccine in our shelter environments when we see a case in shelters. So we have kind of the system worked out. We just haven't, since we have not identified anybody in a shelter-based care setting, we haven't done that. But it's not been, there's not a lot out there that actually, not a lot of people know that we actually had vaccine. The health department, within 10 minutes of us being notified that we were accepted into the HRSA program, we had like 3 emails from the health department asking how we got vaccine. They were very, very interested in that. But we haven't advertised to the general public because HRSA was very specific that these were for our participants, and we identified, to us it means people who are already registered, and then if anybody wanted one, I think we're now to the point where we probably will like get some more community or advertise more to the community, and we would be able to use then anybody, as long as we register them as our participant for that day, can get a vaccine.
I'm glad you were able to get them. Yeah, it's interesting. It'll be interesting, I think, to see how when communities are affected, how able they are to get that, and then what the uptake might be among that. And yeah, Kelly posed a good question around how is the messaging happening, and what are people responding to that particular messaging to, and whether or not it increases their desire to get the vaccine versus decreases the desire, depending on how they've identified who is at risk for it.
You know, the thing that really is always, I don't know why, but it kind of surprises me always. It shouldn't, we had multiple multiple gay men who are our participants who are vaccinated in other events. But there's always a subgroup of people who were hesitant, who didn't get their vaccine at the first opportunity they could, but then were willing to get it because we offered it and because we were the trusted source. And I think that's always our key and always our strength.
Yeah, and perhaps, I think Kim is on the call perhaps, but working with the vaccine ambassador programs, I think the work that's been done in communities around that hopefully that is a lesson that can be built on in a positive way over, as this progresses, and certainly as other infectious diseases come through, and being able to utilize that trust and that platform of trust and of allowing people to ask questions and feel comfortable and be more likely then to take up the vaccines as needed. So yeah, I hopefully that's a model that we can continue depending on whatever the disease or infection might be that we are trying to work towards and prevent. So I think it's coming somewhat close to our time, so I'm just going to allow anyone to sort of ask a question of each other. If there are any remaining questions we haven't covered today, or issues that you foresee coming that you want to bring to the forefront, we'll open it up for a couple of minutes just for folks to be able to do that and share that, or drop in any thoughts that you've had since we've had this conversation. So what I will say is stay tuned again, as this is evolving among different communities and people have different experiences. We will certainly be keeping a pulse on it and updating our resources as needed, specifically for our community. And again, we'll keep sharing resources from our partners, from the CDC and from HUD, as those are developed, adapted, updated as well. And as I mentioned, if you have specific questions, please reach out to us. Again, that's an area of TA that we can do. Obviously, this is new in a lot of communities further along than others. So it may be hopefully connecting folks who are addressing some of the same issues, but we'll do our best to answer your questions. And again, if you have any examples, things that you have done in your program in terms of policies and procedures or quarantine practices or supporting harm reduction during this, we would love to see those. That can be really helpful for us to help disseminate. And so if you have any of those, please go ahead and share those with us as well. And then Katie, do you want to talk briefly about the resource that you dropped into the chat here?
Sure. This was actually something from Courtney had passed along, but it is the Madison and Dane County Monkeypox Isolation and Quarantine Center referral protocols. So, and I don't know if Courtney has any more information on or guidance from those who shared it with her, but we do have a couple different, and we could follow this conversation up, I think, with some of the links that we've put in the chat, as well as we also do have some from the searchable links, but I can drop them in San Francisco and Alameda County. I know it can be hard to grab things from the chat as we're going along, and I'm guilty of not knowing what we had, losing them as I scroll. So was there anything else you thought helpful to add about this, Courtney?
I think Courtney might have lost connection. I don't see her on anymore.
Very possible. So she had passed that along to us, and we just wanted to post it to get to you. And we will definitely include more of these. We're slowly collecting them, and we'll share things. And I believe, have we made a decision, Kate, on whether we will have a specific disease section on our website? Has that been discussed? Do you know? I think we get to the point where it's like, if we hit a volume that's worth that we have enough good resources, is when we kind of decide that we can become a central hub for them. And as with all things, they're evolving a lot. But I do know I was on a federal call this morning, and as Courtney was mentioning, HUD said that they would be coming out with 11 documents that they anticipate very soon. They were hopeful within the next week. They're at the final stages of clearing. So that link that we've dropped in the chat for the HUD exchange is where they will be posted. And if you do receive HUD alerts, you will also get them for that. But if you don't, you may not want to sign up for too many more emails, but you at least will have the resource to check back with.
Great, thank you, Katie. So logistically, before we do a sign off today, Brandon, if we want to go ahead and launch the poll, we can do that before we sign off. So yeah, stay tuned for all of these resources as things are coming up. And again, if you have particular questions, issues that come up, again, please reach out to us and we'll be happy to try to connect you with somebody who's maybe a little bit further along, as well as some of the resources we know about from our partners. So other than the poll, I think we will go ahead and sign off and end for today. And we'll hang on, of course, for a minute or two in case anybody has any individual questions they'd like to ask. But thank you all for joining, and we'll look forward to chatting with you at our next respite event as well. Thanks, everybody.